to the next slide, then let's think about some big principles for trauma-informed care and sort of how we can begin to think about these in the work that we do on a one-on-one basis with folks, or even at the level of entire systems. And so SAMHSA, in addition to talking about the 3 E's of trauma, also gives a sort of basic overview of 6 principles that they say are essential for trauma-informed care. And the 6 principles that they talk about as being essential for trauma-informed care, and I'm just going to quickly go through all of these real quick before kind of speaking to each one individually, are safety, trustworthiness, and transparency, peer support, collaboration, mutuality, empowerment, voice, and choice, and then cultural, historical, and gender issues. Now, I want to just briefly start with, or not necessarily briefly, but I don't know that we have enough time to go through all of these in as much detail as I would like, but I want to start with this last one here, cultural, historical, and gender issues, because I've actually heard some interesting discussion around this that I think is important to consider, right? The inclusion of that specific element as a principle has actually been critiqued by a number of folks, right? Specifically because it assumes that that's a principle that exists alongside each of these other ones, when in reality, I don't think we can provide safety. I don't think we can provide trustworthiness. I don't think we can be collaborative, and I don't think we can empower people if we're not sensitive to cultural, historical, and gender issues. So in some ways, thinking about that as a separate principle may not be the best approach for us, right? It's something that has to sort of, I think, encompass all of these other principles, and we have to take that approach in viewing how we implement each of these other principles if we truly want to be trauma informed. So if we start from the basis of assuming that all of our work in building any tiered model has to involve careful attention to cultural, historical, and gender related issues, what does that mean, right? Actively moving past stereotypes and biases and offering inclusive services. So that means that I think individually, we all have a responsibility to be mindful of and aware of our own biases, what that means, what that looks like, right? And then we also have to be mindful of the biases that are in our system and work to dismantle those when we're aware of them, right? If we're not actively doing anti-racist work personally or in the classroom, how are students who've historically been targeted for oppression going to feel safe? So I think that we have to keep those basic principles, or that basic idea at least, in mind before we can begin to implement other principles. And let's just start with safety, right? So when we think about a principle of safety, ensuring physical and emotional safety is going to be key when we try to implement any kind of tiered model that provides a number of different levels of support for trauma survivors in a broader system like a school system, right? So when we think about safety, how can we actually make sure that we create physical spaces, right, for folks to feel safe? How can we approach people in ways that helps them feel safe? And how do we ensure that? So I think that's something that'll be important for us to consider. And when we go through our breakout activity later on today, we're going to think about just even things that you can say, right? When you're talking to someone or talking to a young person who's, and you're not sure what's going on, but if you were to consider safety and consider how to have those, discussions with kiddos about potentially sensitive topics in a trauma-informed way, what would you do and what would that look like? So that's one thing that I think is important for us to consider, is to think about what safety means, how we can use ourselves, how we can create physical spaces for that. Trustworthiness, right? Within organizations, we have to make sure that decisions are made with transparency, right? With the goal of building and maintaining trust for all. Okay, so within school systems, right, if we think about what that might look like, what might it mean to build trustworthiness if we were to think about implementing a tiered model, right? That's something that I'll challenge all of you to kind of think about what that might mean. But how can we actively engage and make sure that all stakeholders involved in a tiered system have a say, right? And know what everybody else is doing. I think that's really kind of the key of trustworthiness. Peer support, right? Using and utilizing stories and lived experiences from people to help promote healing. I think sometimes, especially if we're talking about working with older kids and youth, right, and adolescents, a number of trauma-specific interventions for older kiddos is going to involve groups with other folks who've gone through similar kinds of experiences, right? Working with your peers and making sure that peers are available to support you. I think that's one of the real value of having different kinds of groups where you can be with other kids similar to you and your age. And even for for teachers, right? Educators, professionals, those of you that are working within these systems, how do you support each other? And what kind of peer supports do you have in place to support each other, right? I think we can always draw strength from one another, and that's really the basic idea of peer support. Collaboration and mutuality, right? We all have a role to play, and even by being here today and learning about how you can have a role in building these kinds of tiered models and think about what you can do within these tiered models, we're really thinking about collaboration together, and that's a really important thing. Empowerment, voice, and choice, right? We want to make sure that folks' strengths are recognized, built on, and validated. Okay, and so I think that really when we think about that, that means that we want to give folks choices where we can. That can be something really small that you do for someone, an individual in the classroom. That can mean that when you're making big decisions about who's involved in a tiered model at the system level, everybody who's involved in that system has a say, right? And you all talk about it together. So there's a lot of ways to ensure empowerment, voice, and choice. And of course, we talked a bit, and I started by talking about cultural, historical, and gender issues. And I think, again, all of the principles that we've considered here have to be made through the lens of awareness of working past stereotypes, biases, and making our services more inclusive.